And welcome to the very first episode of the Wellness Paradox podcast. I'm very grateful you've joined us on this journey towards greater human flourishing. I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena that I call the wellness paradox. This paradox, as I view it, is that we know infinitely more about human health and well-being than we have at any other time in history, yet there seems to be an ever-widening gap between what we know and what we can truly actualize in the real world to make a real difference. This gap seems to be ever widening as we grow more siloed as a health sciences community and as greater inequities manifest themselves in our world. This podcast aims to close off those gaps by disseminating the latest, most evidence-based, and most engaging information in the health and well-being sciences. I truly believe greater well-being is within the reach of all human beings, and it's only by coming together and collaborating in good, productive, generative conversations that we as a health science community can actually make the profound impact on the world that we're looking to make. That's what this podcast is all about. If you're a health scientist in any part of the ecosystem, from healthcare and medicine to fitness and nutrition to even psychology, mental health, the social determinants of health, and public health, this podcast is for you. The goal of this podcast is to come together, collaborate, start conversations, and we hope to be a portal to disseminate information to the rest of the health sciences community so we can all truly flourish. I'm grateful to be your guide on this journey. I hope you join us weekly. We'll publish episodes weekly through all the major podcast platforms. Please make sure you subscribe to make sure that gets dropped onto your smartphone every week. Now, without further ado, I'd like to get to our first episode where we're joined by Dr. Tom Rifai. Dr. Rifai is the former head of metabolic health and weight management for Henry Ford Health Systems in Detroit, Michigan. He now has transitioned into the private sector with his company Reality Meets Science. And I think you're going to see a lot of Tom's unique story as we get into the podcast. And you're probably going to be able to see very quickly why I chose him to be our first guest, because I think his energy, his enthusiasm, and his message really meets the threshold that's necessary to address the wellness paradox as I see it. If you're interested in finding out more on Dr. Rifai or any other information that we present in the episodes, such as research or links to external websites, please go to the show notes page on our website by going to wellnessparadoxpod.com/episode 1. I hope you enjoy the conversation with Dr. Tom Rifai. Tom, thank you so much for joining us today.
It's my pleasure, Michael. I really am looking forward to this.
Awesome. So we're going to get into a great conversation today. We're going to start a little bit talking about Dr. Rifai's background and kind of the journey that he's been on. And then we're going to get into some really interesting conversation around therapeutic lifestyle change interventions to help mitigate chronic disease. And I think this is such an important discussion to the challenges that we face in health and wellness. So, Tom, I want to jump right to it. You've had a unique journey that's led you from physician parents who kind of discouraged you from getting into medicine to then becoming a physician anyway. Then you were the clinic leader for metabolic health and weight management. And then you were able to actually open up around your binge eating disorder. And then you also lost your brother in this process. And now you're onto this entrepreneurial venture to help millions of people find, where reality meets science, as you would say. So this is not your standard, I went to undergrad, I went to med school, I practiced medicine. It's very much an undulating journey. So talk a little bit about your journey, just to provide some context to our listeners for the conversation.
Wow, that is probably the best overview. Can I take that and wrap it up into a beautiful storyboard? That is really helps me put things into context for myself. But absolutely, thanks for asking. It's true. I have two parents that were physicians who, particularly one, my mother, I think because of where they came from into medicine in the Middle East, where they came from, if you did very well graduating high school, you really didn't have a choice. You're going to be a doctor, whether you liked it or not. So they kind of felt forced into it. And as as immigrants to the United States, they were all about America, freedom, and, be a baseball player. I mean, my dad, he practically stalked Mark Fidrich, the bird, to get an autograph for me. And the thought of becoming a doctor for my dad would have been maybe okay, but he definitely didn't encourage it. On the other end, my mother was absolutely brainwashing me, inculcating me since I was probably 3 that all doctors were insane, all doctors were crazy, don't be a doctor. She literally programmed it into my head. So my journey kind of led towards, they were divorced and there was some trouble there, and it led me to some counseling. It was phenomenal. I mean, this at 14, this PhD cognitive behavioral therapist showed me a science of how to do brain surgery without a knife that so impressed me so much. I said, I want to become a psychologist. And that was my drive, for my undergrad and at Michigan State, in psychology. And what happened though was, as I was applying for grad programs, Mike, I had a panic attack. I was at the GRE, the Graduate Records Examination event in Boston, where you kind of did this dating table thing where you met all the programs. And I said, there's just something not right here. And I said, called my father. He was supportive. And I said, I think I'm gonna have to search. I went into nutrition for a term at Michigan State. I'm like, I like that, but it's not quite it. I went into exercise science, became an exercise science undergrad. And in that moment, we were the only undergrads at the university allowed to be in the cadaver lab. Otherwise, you had to be a master's in anatomical art or a medical student. Mm-hmm. And these medical students came in the room with a professor, I guess, of pathology. I don't think it was a cardiologist, but it could have been. But went over to a table of diseased hearts, showed all the knobbiness of the left anterior descending artery and said, this is atherosclerosis. This patient didn't exercise, was stressed out, and didn't eat well. And I said, you didn't just take psychology, nutrition, and exercise and wrap it into a sentence, did you? It was probably the best definition of an epiphany I've ever had. I said, I got to be a doctor. That's obviously the place to do it. And I realized the block and everything. Called mom, said, this is going to be a bad call. And all I got was, that's great. What? Well, I didn't push you into it. If you want to do it, that's fine. But don't, okay, great. So I finished my pre-med with a psychology background. And even then I wasn't sold, Mike. I actually became an endocrinology assistant for 2 years with a professor at Wayne State University just to make sure. And then I think it was just the deal was sealed. I went to Wayne State and they had a good nutrition program. And then I did my internal medicine training at Beaumont, which has a nice lifestyle type program. And so I really curated a nutrition or lifestyle medicine fellowship because there wasn't one that existed at the time. So and then I went right into, even though I trained in primary care internal medicine formally, because I did so much moonlighting and so much extra training on my own in metabolic health and lifestyle and weight management, I went right into multidisciplinary care programming with one of my mentors, and kind of tried to find a comfortable place that would allow me the time needed and wasn't necessarily the gerbil on the treadmill kind of scenario. And to make a long story short, I realized, though, I was pretty snobbish against apps and books and so forth, because when I was always asked, when's your book coming out? When's your app coming out? And I'd say, well, look, I see people that have done 6 apps and read 10 books, and I fix everything. So, and then I really started to realize, what? Digital is becoming very much advanced. The problem is so big. Specialists like myself in programs like ours are so limited in how many people they can see. There is no way to address this problem without going digital. So I decided to take a chance after having my position as regional medical director for metabolic health and weight management at Henry Ford, where I still have a wonderful contacts, and developed this 5 keys to optimal wellness system, which still runs there and it's licensed there, and they run it in a standard clinical fashion with a dietitian, and decided to bring it into the entrepreneurial space. And so we're building step by step a fully tech supported platform starting online. I differentiate that from tech because in the end it really is going to need to come down to an app. That's the detail. And thank you for asking. The loss of Basil, which I'll dedicate this podcast to, and I'm dedicating my book to, was a very hard loss. My youngest brother didn't survive, and in a sad tragedy, went through a similar moment that I did. To be frank and honest, the binging was so bad at one point for me that one night I stuffed about 2 large pizzas in my face before going to sleep, and I woke up asphyxiating myself, aspirating vomit. And I just barely got the air into me before I knew I was about to go. Unfortunately, basal due to other issues, and complemented with some probably some alcohol and substances, was not, although he clearly struggled, we could see from his body and the way that it was placed, he didn't make it. So yeah, it's tough. It was tough to watch that. Beautiful guy.
Yeah, we appreciate that kind of transparency, and I think, you know, something that humanizes medical professionals, I think, is a very important way to connect with the population at large. And what strikes me about your story is that it is very human. It's not just, you know, the standard mechanistic process of going through med school, becoming a doctor, and churning through patients. It seems like you've, at several points along the way, you've realized these epiphanies about a better way to serve humanity. And I think for me, that's what this whole wellness paradox thing is all about. It's all about, like, there's a bunch of people out there like you that are just trying to serve humanity, who are continually iterating to figure out a way to do it better. And, you know, you did it in the clinical system at a really high level, and you've left a legacy there, but now you realize you can cast a wider net with what you're doing by not having it encumbered by the health system, which is great. And that's what I want to get into, because it's clear that you're passionate about this concept of therapeutic lifestyle change interventions, which is a bit of a mouthful. But, you know, understanding it like I do, I feel this is one of the keys to addressing this whole wellness paradox. Talk a little bit more about therapeutic lifestyle intervention. What does that mouthful actually mean? Who is it for? And what's your experience of the efficacy of these types of programs?
Well, that's a great question. In the clinical realm, in the ideal setting, it should involve typically a multidisciplinary care team, where there's a behavioral health specialist, dietitian, exercise specialist like yourself, and ideally a physician who's there for not just, you know, de-prescribing medications, for instance, as people get healthier, but hopefully has some knowledge, if not in comprehensive lifestyle, at least in nutrition or something. Maybe he's gone through some well coaching or something along those lines. And those programs have been very well vetted all the way up to, and I think some of we briefly discussed, randomized controlled trials, the diabetes prevention program, for instance, and the Look Ahead trial, two large NIH trials, multi-center trials, use this kind of a model, a curriculum of skills taught by professionals, you know, in a one-on-one combined with group setting. Of course, it's all in kind of brick and mortar, and while there are some online versions of it, we can talk about how far they've evolved and what might be a better approach. But that is really the sine qua non of a therapeutic lifestyle change, or otherwise known as intensive lifestyle intervention. Intensive doesn't mean they make you vomit on the treadmill like on that show, but just relates to the time. The time spent has to be significant. The U.S. Preventive Services Task Force might, for instance, say something along the lines of at least about 14 sessions, or I would argue, 14 hours over 6 months, and to have any at least evidence base of a chance that it would be effective. Not that something shorter couldn't be effective, they would just say there's no evidence for that. With that said, who's the best candidate really comes down to something really interesting, because most people would say, well, it's clearly the people who cost the most and who are at metabolic risk. But what I'm here to say is it's clearly based on the stages of readiness for change more than anything else. You cannot try to bring a horse to water is the analogy, but you cannot force something upon someone, no matter how much disease they may have and how smart you think as a coach or as a professional it might be for them to do something. You really just cannot take over the steering wheel of somebody else's journey. At best, you can be a navigator for someone who's welcoming you in that seat. And this is reflected by the U.S. Preventive Services Task Force guidelines recently. I think it was in 2018, I believe. And while it only received a level C recommendation, so it wouldn't, according to the Affordable Care Act, therefore be required to be covered by insurance, it still showed that there was a significant amount of science behind the recommendation that if someone is motivated for a lifestyle change, irrespective of their baseline status, essentially saying the risk is so high in the United States that they will become diseased, don't miss this opportunity and refer them. Because as you and I know, if you look at the American Heart Association, for instance, simple 7 criteria for healthy eating, physical activity, weight, smoking, blood pressure, cholesterol, and blood sugar, only 1% of Americans meet all 7 in the ideal category. So there's almost no one that can't benefit. And so while in theory, the best would be the motivated and at cardiometabolic risk patient, type 2 diabetes, coronary disease, high issues with excess weight, so on. Really the best candidates for these type of interventions are those that are motivated. That is really now evolving, though, in terms of how to deliver it. In terms of, for instance, the diabetes prevention program, how do you scale this? Well, they have tried to reach out to YMCAs, for instance. Let's try to get it out in the communities. Let's see if we can teach community members to do what we did in the interventional trial with dietitians and psychologists. Since there aren't enough on the ground specialists, we'll have to train people in the community. And therein, I think, is kind of an issue. There are going to be, and there are already, digital opportunities for the DPP, but the diabetes prevention program, while very, high respects, I've been studying it for years, following it for years, and trying to apply it in clinical practice. In fact, I would say at where I was last practicing, we actually had it to a look-ahead trial with a physician added to the mix. But maybe we could talk a little bit more about where there are some potential areas for improvement. Beyond that, the need to really go to smart digital, to reach out to a number of people and leverage the, unfortunately, too few specialists that are with features like artificial intelligence and machine learning to just really continue to build a delightful experience that would be at a solid enough quality level that you could reach millions, at least if you're going to keep the price low enough. I mean, sure, if somebody wants to buy a membership that's way up in the gold level, that's another story. But you've got to have something that's practical and cost-friendly enough to reach a number of people.
Yeah, man, there's so much good stuff there that I want to follow up on real quick. The first thing is, I don't think people understand, at least people outside of the metabolic health realm and the diabetes management realm, understand how truly landmark the DPP trial was in terms of its outcome measures and its efficacy. Can you just quickly give those phenomenal stats? Because I think they really knock you back when you hear them.
They do. I mean, it's still to this day, it's unbelievable that the main segment of the study was completed in 2003, and there are people that are still surprised by the findings. But they basically took a little over 3,000 pre-diabetics and randomized them to either a placebo pill, an actual pill called metformin, which is the most commonly prescribed first-line medication for diabetes, but so safe and relatively speaking, and maybe we could talk about some of the emerging evidence there that I've recently made myself aware of, but essentially so safe and inexpensive that without much of any hypoglycemia risk, that they said maybe this is a drug to help not only treat but prevent diabetes. Then the other 1,000 were put into what you would call an intensive lifestyle intervention. Now, intensive it sounds like black or white. There's certain levels of intensity, and maybe DPP isn't as intense as it could get, but it was a curriculum-based, multiple group meeting with one-on-ones, and to target a weight reduction. Well, they asked them to lose 10% because they were very wise and hoping they would get 7%, and they did. They got a 7% weight reduction, largely driven by changes in food and physical activity, and some other, basics, maybe regarding stress management and so forth. And that outcome, if you want to know the results, versus the placebo group, the metformin group converted from pre-diabetes to type 2 diabetes by about 30% less. So that was a robust result. The lifestyle intervention group was 60%. And in fact, the subset that lost 10% of their body weight, and that's not a lot. I mean, a lot of people would think, well, I weigh, you know me, I don't like to worship at the altar of the scale, but let's just cut to the chase. I weigh 240 and I need to get down to 180. That's my fighting weight. That's what I graduated high school from. That's what I was when I was in the military or whatever, or what I got married at. And that would be what, 60 pounds, right? So that would be taking someone over 25% body weight reduction. Yet we have evidence from the DPP that those that just lost 10% of their body weight didn't reduce their risk by type 2 diabetes by 60, but by 85% over about 4 or 5 years later. And of course, they did it in a certain way. I mean, you can't say one weight loss is the same as the other, but there's a lot of intimate relationship between type 2 diabetes and weight. We can argue about what might be a better way, but at the end of the day, that's a massive, massive risk reduction. Now, some of the problem is that if you look in the diabetes prevention program outcome studies going way out now, decades, we find that the metformin group has slightly better long-term residual weight loss, about 6% versus 4%. So there's something behind the story of sustainability, and that maybe we can discuss about the paradox and how unsupportive our national environment is to maintain lifestyle changes.
Yeah, it's very interesting. If memory serves me correctly, I think the group that was over 65 saw like a 71% improvement. And so, like, just to summarize those statistics for everyone, metformin, which I even think the lay public has heard of because it's became so commonly prescribed, 31%, and the general lifestyle intervention group was 60%, and then these groups that were older or lost more weight were 70+% and above, which is impressive by any standards. But as you said, certainly looking out longer term, that becomes the challenge. So let's talk about, I don't want to necessarily say the shortcomings of the DPP in and of itself, but there are other therapeutic lifestyle change interventions that are out there. What are some of the shortcomings in your estimation? I feel like you answered this a little bit in some of the things you were saying earlier, but you're an expert in this realm. So what are we not doing that we could be doing? Where are we falling short?
Well, this is obviously, again, with all due respect, I was a DPP advisor for a large hospital system running the program, in fact. And there was one block, for instance, and I helped try to train the trainers around it, focusing on low fat, counting fat grams. And while that indirectly may get you somewhere, because fat is more calorie dense, right? And whether we like it or not, calories still count. And when it comes to cutting diabetes risk and metabolic ward studies from the NIH from Kevin Hall, we pretty much see that however you cut calories, it's pretty much nobody has been able to disprove the first law of thermodynamics. I mean, it's still there. There may be some subtleties how you get there, but it's still there. With that being said, a more advanced approach would be to look at calorie density. So in other words, you might have more fat grams, but for instance, if you were going to say, all right, but I'm really going to try to pull back on, without extremism, but pull back on refined carbs and then go more vegetables. So I still have this volume and a total number of calories that's reduced, but I may not be low fat. I might be higher fat grams than the DPP recommends, but I still end up through the concept of calorie density or calorie concentration, if you will, calories per bite of food. I still get there because we have pretty solid evidence, and I get the real, so blessed to be working with, and we're authoring together an article for the American Journal of Health Promotion, myself and Professor Barbara Rolls from Penn State, who is the queen of calorie density. She's written 3 books on it and published innumerably and has tons of NIH data. People tend to get full more than anything else, not nothing else, but more than anything else on the weight of food. And this is something that's also just kind of insightful to people that, we eat about that, 1,000 to 1,500 grams a day, and everyone might be slightly different where they're happy at, but that changes very little in a free living environment. I mean, if you're on the island that Tom Hanks was for Castaway, you're going to eat whatever you can find. But if you're in a free living environment, we tend not to really do too well with that eat less, move more. We'd say, fine, eat less calories, but you can actually, because food ranges from 70 calories per pound to 4,000 calories per pound, taking you from broccoli and lettuce to butter and oils, if you want to just one fell swoop, depending on the water content of the food, the internal water content matters. In other words, you can't, drink water with raisins and pray they turn back into grapes.
Yeah, right.
No. I would say raisins over jelly beans. That's a quality issue, but quantity wise, it takes 8 ounces of grapes to make 1 ounce of raisins. I would say, please, if you're thinking about sugar and fat, eat dried fruit and nuts over a whatchamacallit bar, unless that's your non-negotiable 5% fun zone. In that case, do whatever you feel you need to do. But you really have to understand that concept. And that's one area, for instance, that the DPP, we in the program that I put together in the 5 keys to optimal wellness and nutrition really focused more on that, because it does to be zero. It's not zero, but to be really strict in one area rather than provide a way to get there without having to be just low fat or just low carb. As you know, I'm a flexitarian. So I think that you have to give people, if the science is there, more flexibility, and calorie density does it better than low fat.
Yeah, and I think what you captured there, I think, is just the general criticism of a lot of the intensive lifestyle interventions that are out there. Sometimes they don't get granular enough. Sometimes they don't get individualized enough. And you mentioned your 5 keys model, which I absolutely want to get to, but I have to circle back to one thing you said, because
as someone who has a coaching background, it really caused my ears to perk up when you said it. You talked about people having to be motivated, and you mentioned the stages of change model, which those of us in the coaching world, and you mentioned Well Coaches, which is Margaret Moore, an amazing program. Talk to me a little bit about where, as a physician, you got your coaching lens from that you look at things, because most physicians are viewed as experts and they conduct themselves as experts when they interact with patients. If you're looking at things from a coaching perspective, you're not looking at being the expert, you're looking at being the collaborator. Where did that come from for you? Like, where did you learn that?
Well, I think it was from being coached. That year I spent in the chair and really having, call him a cognitive behavioral therapist. He was my life coach,
Yeah.
Dr. Steve Frank, to be specific, phenomenal cognitive behavioral therapist. That was one thing, to just really see someone who wasn't judging, who was just presenting information. You know how cognitive behavioral therapy works. That was one. But I'll have to tell you, there was a specific moment, I think, that kind of really, it's so clear in my mind that I think it may have had a significant impact. Because for us docs, we look at these metabolic changes and we see fatty liver go away and we see the A1C go away and we get all excited. And I used to take time to write smiley faces on the lab results. I really prepare something for the patients that I was excited about. But all too often, and in one particular case, after leaving the exam room and just going, I'm so proud of you, handing over all these labs, that she, was just nodding and, I figured had no questions. She said, Doc, I got to admit to you, I really don't know exactly what you just said, except for I'm doing really well, but I just can't wait to go to Cedar Point and be able to fit in a roller coaster with my granddaughter. And I thought to myself, as much as me, I'm not about the scale or anything, but this was her journey. This is what she wanted to talk about. I could have been much better off and just asked, hey, you're just doing awesome. Anything else you want to talk about? Because then rather than having me take the steering wheel and go, look how your ALT level went down. Look, your GFR went up a bit. Look at your fasting insulin level. And she's like, hey, you okay? You said it's good. That's good enough for me. Can we maybe take this time to talk about something else that I would like to bring to the table? I never had a chance to ask her that. And that kind of hurt my feelings, not in any intentional way, in a tough love kind of way. Maybe it didn't hurt my feelings, but it gave me some good feedback. And I said, you know what? I really have to start asking people more what their priorities. I have, as a physician, you're coming to see me, I have a certain fiduciary responsibility in a sense. I have a professional responsibility to discuss some things that at least offer. If somebody came and was smoking, for instance, and they're not ready to smoke, I would at least just say, look, this is something I'm concerned with. If and whenever you're ready, can we talk about it? And then I can at least document that I've said something and move on, but I'm not going to try to ram a nicotine patch, I was going to say down their throat, obviously it would be on their arm, but whatever the case may be, or stick some Nicorette gum in them. That moment really was one, and I think combined with the background and then my of having been coached, and then I hadn't come out with my binge eating then, but I think that part in me, that compassionate part, although I thought I was compassionate, I was very rah, but that, as you mentioned, it's not coaching. That's being a cheerleader. That's different, and that could be a moment in coaching, but it's a different role. So
that's such a great story. We have those inflection points in our life that I think we can go back to, and I've had very similar moments where your moment is similar to mine, and I won't get into mine, but it's basically the moment where you realize that this experience is not about you as the coach or the physician or the clinician. It's about that person that's sitting in front of you, and that empathy and that compassion is so key. And this is another podcast entirely, but man, if more people in the medical profession could find a way to access that level of empathy and making it about the other person's journey, I feel like we would take some pretty significant steps forward to closing off the paradox. Great story.
You're right, and I think we have a confluence of issues, unfortunately, that may be able to be answered in some quick manner with just one simple ask of physicians or anyone, whether a nurse practitioner or exercise physiologist, kinesiologist, anyone in the professional realm. And but when it comes to physicians, one real block is we're kind of trained by it's almost semi-military like. I don't know that people's personalities don't get twisted in the process. They're really kind people, and they might not be that way when they come out of medical school. I don't feel that way for me, but I've seen some changes in personalities after you. Back in the day when they could keep you up for 36 hours straight and so forth, and you just had to survive. And really, the other part is it's really more disease-based training, not really prevention training. And I think there's also just this, because of all that, and I don't want to call it godlike complex, but in a sense, being expected to be the expert, that, you can't come in with I have any weaknesses. But I would urge, you will add, I think you mentioned this earlier, you will add a lot of credibility. You don't have to over-identify with the patient, but you coming in with some of your own, hey, I'm human too, and not to spend 20 minutes talking about yourself, but be honest, the data on physician health, I mean, it's a little better, but it ain't a dramatic difference. Sorry, my English teacher's rolling over with my ain't there, but the point is made. Even in terms of cardiologists, I remember seeing a study in which how many knew that fruits and vegetables were very healthy, but that weren't actually eating that amount, probably because of whole lifestyle and a number of other issues. So come into that as a partner. You can actually switch hats. You can put on an expert hat, walk and chew gum at the same time. Say, you know what, this is going to be a human hat. I'm just here for you. I even try to avoid Dr. Rifai. I kind of say that's my dad. I'm Dr. Tom at most. I just want to, and it kind of gives me a nice middle ground. Sure, the doctor's there, but let's just, and I never wore a white coat. Look, that's their professional choice. But once I got done with residency, I said, unless it's for a promo or something that the hospital system or practice I'm working for wants me to have a coat for a picture, I really don't want to come into that just puts a barrier to me, in my mind, between me and the patient. So those are some tips that docs or other professionals might use.
Bringing the human element in. Wow. It's so simple, but so profound. All right. I think we could talk about that forever. And that's maybe we'll invite you back for a podcast in the future. That's the whole other conversation. But I want to get into your 5 keys concept and the flexitarian approach. You mentioned that earlier. Some people may not be familiar with it. You've described this to me as, and I laugh when I hear you say it, the diabetes prevention program on steroids. To be clear, we're not giving anybody steroids with this program whatsoever. But your 5 keys model it's impressive and it's different. Talk about how it differs, not just from the DPP, but also there's Noom and there's Weight Watchers. There's programs out there that are making a difference. What is this? What is flexitarian and how is it different?
Well, I think the nice thing is that it transcends all of those. You can learn the system and still be very compatible with Noom, very compatible with Weight Watchers for sure. I mean, anything that's not way out on the spectrums, but somewhere in that flexitarian world. So let's just, I guess, for the first moment, just define this word, since we brought up an odd word that some people may not know. Flexitarian is really just the blending of the words vegetarian with flexible. Some people might call it semi-vegetarian, but again, that gets to more clinical and doesn't sound fun or interesting. So I can't remember who coined the term, but it was I think it was more than a decade back. And I think it's a genius terminology. But it's really focused just on the concepts of food, yes, I want to be more plant rich, less processed, less refined, but I don't want to have an absolutism issue if I go out with friends or whatever the case may be. And therein has really gained a lot of respect in the science community. And for the expert committee of the U.S. News and World Report, for instance, flexitarian has been moving up, is now tied for number 2 with the DASH, dietary approaches to stop hypertension, inching right up to Mediterranean. And now those have much more optics, but inside the scientific community, the concept of flexitarian is, I think, particularly attractive because precisely it's not rigid, that it's something that people feel they can follow. And large surveys of Americans, over 70%, if they were given a choice between all out plant pure or just, lacto ovo or one end or the other, 70+% say flexitarian is something I can live with. So it makes a whole lot of sense. And therefore I really want to bring that word out and really lead that flexitarian concept, but beyond food to lifestyle. Discipline without extremism is really the way I can summarize it. You can't live your life in a pressure cooker without a release valve. Having absolutes, I have to get exactly 10,000 steps per day, or every day has to be over 10,000 steps. Or I have to, always go to bed by a certain time. I'm not saying don't follow those principles in general, but, you start to drain someone's mental energy and willpower if you put too much force into the absolute need to follow some guideline as if it's a commandment. And as a matter of fact, it can sabotage the long-term 95% of what we're asking people to do if they don't have as we say in the 5 keys, a 5% fun zone. So it goes beyond just nutrition to lifestyle. In a sense, not to compare beyond this, but for instance, veganism is not just about food. It's about everything. I mean, if animals were utilized to make footwear or obviously coat, whatever the case may be, it's not just about food. Flexitarianism, not in that sense, but in the sense that it goes beyond just food, is also similar in that specific regard. And in terms of the 5 keys as a reflection of it, this came to earlier. You already know that I'm sold now that digital's the way. I didn't necessarily mention about the whole book thing, but I can tell you this: where the 5 keys grew out of was a conversation that started with a cardiothoracic surgeon partner who sat down with me in a doctor's dining area and said, "So, Tom, when's the book coming out?" And I said, let's just say, his first name is Chuck. So let's just say, Chuck, it's not coming out. Again, you know what I was about to say. Everyone that comes to me has read 5 books and done 6 apps, and I'm the guy that. And then he sat back and said, Tom, you really don't understand. You need to get your message out there. It's not that everyone in the world's going to be saved by your book, but what it starts may. Now write and I can't say the word that he said, but it starts with an F, book, and walked away from it. And I remember, I'm like, that is a surgeon. That's how they talk. And I remember seeing his back. And I go, you know what? I really do need to write the book. I reached out to a friend, actually Tonya Reinhardt at Wayne State, one of the co-directors of the nutrition program, and told her about my idea to write a book. And she lovingly gave me some tough love feedback and said, Tom, I love what you're saying. I'm processing it because of what I do, but it's still like drinking from a fire hose. Can you whittle it down to 4 pillars? What are your 4 pillars? And come back to me. It was an amazingly great exercise. I had to put into my mind, what are the 4 pillars of transformational lifestyle change or therapeutic lifestyle change, however you want to define TLC. And I'm glad she said 4 because there are 5, but the stress test of 4 forced me to get it down to, in the spirit of Einstein, right? Everything should be explained as simply as possible, but not simpler. And it came down to psychology. We call it mind matters to soften it up a bit, but psychology, nutrition, activity, obviously, I don't have to convince you of that, environments, and that's social, food, and even physical environment. I mean, for instance, we live in a 4-season state. You hate exercising in the winter. I got something for you. The fall is a warning. You can think ahead of time what to do for the winter. And then, of course, 5th is accountability. I call it compassionate accountability, and that can go anywhere from tracking and self-accountability to a full program. And that being said, those were what I saw were the 5 keys to successful transformational lifestyle change. However it's delivered. I mean, I've seen on social media people who have sent me testimonials, not even doing the masterclass, who have done really well with this compartmentalization and simplification. Now, simplification and making it easy are different. If your friend is stuck under a car, it's not really complicated. You better find 7 other strong guys and lift the darn car. I don't need a PhD in physics or in any physics formulas to do that. But is that easy? No, but it's not complicated. So we don't at least want to make it complicated. There's such a cacophony of confusion over nutrition out there and lifestyle and what to do that people they're blinded, and they're in combination with that swimming in a sea of messages to do the opposite. I almost feel just for the sake of some credibility here in the movement, I'm going to stand for a second because I was about to say we have all these chairs and we have all this, what I will lovingly call, and believe me, I need a little crap food once in a while in my 5% fun zone as well, but crap, which I would define, it's not CRAP, but CRRAHP, calorie rich, refined, and highly processed foods. They're everywhere. And it's so hard to try to, you can't even possibly imagine that willpower by itself is going to be the answer. Environment is so critical. So if you can teach with this environment that you can't change, because there are really 3 levels of control, right? Things that you can control, things you can influence, and things you cannot control. Well, you can't just pull up every fast food joint out of its roots and just throw it in the garbage. That's not going to happen. What can you do to become kind of a, if you will, a mixed martial artist of lifestyle change so that you have these skills, skill power over willpower, in psychology, cognitive behavioral, positive psychology, messaging, understanding your why, understanding the 3 levels of control, how to manage your energy better. Those are just some samples. Obviously, stress and sleep management and a number of other things fall in there, but just to give a glimpse. In nutrition, we focus on 5 transcendent principles. It doesn't matter whether you're following vegan or Mediterranean, but it's really, understanding your beverage calories are different type of satiety result than semi-solid to solid foods, 1. 2, calorie density of those semi-solid to solid foods. Sodium density, I'd be wax ecstatic on a podcast all about sodium separately. Protein and fiber, which really means smart carbs when it comes to fiber, right? And then obviously, saturated fat, and I would argue cholesterol. But those are really just 5 features, irrespective of whatever you're talking about in terms of nutrition. Then activity, something we've talked about a lot. The combination of, yes, absolutely, I exercise regularly. My mind matters would not be able to be under control without exercise. But there's more to it. There's also non-exercise activity time and this movement naturally and what we do outside of the gym. And many people even start with that because there's so many people intimidated by the gym that we can stage them in their levels of readiness for change, sub-segmenting each of these. So, okay, now you're ready. Now you're ready for the gym. Wherever you want to start. Heck, even if you want to start sitting, but you're willing to go to the gym, you're the pilot. You just tell me how I can help you. And then, of course, an environment, food environment, your home, work. Many people are Zooming a lot, but eventually, nevertheless, home, work, car, even travel, it matters. We are what we eat, sure, but we eat what surrounds us. As long as you think about that, a food bag, it doesn't have to be complicated. I'm not going to go to the PG-13 level I do in the master class, but just throw some healthy stuff in a bag. You can pre-prepare and pre-cook and do all that on Sunday for 6 hours if you want, but it really just requires, mine's a Detroit Lions bag. I leave it on the kitchen island, and I could be half asleep and go, I grab my bag and throw in some fruit and veggies and yogurts and nuts or whatever I'm going to put in my bag, so I'm protected to some degree from if getting too hungry, the corporate food world. Now, we do give a lot of skills in terms of how to understand that environment and tweak orders and so forth, but that's a whole other discussion. So food, and then of course social, we give skills on how to talk to others in a way that's assertive, not aggressive, and not passive either about your needs and your boundaries. As social, and then of course there's the physical environment, as I mentioned. Then there's the accountability, and that's where a program. Of course, it can be as simple as food tracking, blood sugar, blood pressure tracking. You can pick, but what we found is that over tracking can be very overwhelming for some people, and you got to find what is the most value that they are willing to track in terms of that. And then if you're going to go and they're ready to be part of a community and a program, make it non-judgmental, make it compassionate, provide that accountability, but as a partner, not as a drill sergeant. So that's really a quick run through the 5 keys, which can be in a model that's of course brick and mortar, as it is now in a leading hospital system, but it also works in the digital world. It works from the receiving end as a patient or client, if you will, if you're out in the entrepreneurial space like I am now. Or a user, if you will, in the app space. And it can work on the coaching end, whether you're inside the walls of medicine or outside the walls of medicine, as a physician, as a kinesiologist, as even a psychologist. I think there's a lot to really learn from just having this structure, which we put in a pentagon type symbol so that people can always see, it's really there. It's like a band, you can individualize the bass and the 2 guitarists and the lead singer and the drums, but really they all make music together.
Yeah, what strikes me in everything that you said there, and I think the interesting thing about your framework is that it is comprehensive. And you said it earlier, people are swimming in this, not only this obesogenic environment, as we term it, but they're also swimming in this sea of information that is so conflicting. And many people, and I've worked in commercial fitness for 22 years, many people will go 8 different places to get their information. They go to a psychologist for the Mind Matters piece. They go to Weight Watchers for this piece. They come to my gym for the activity piece, their friends or their accountability group. And while that isn't a bad approach, it certainly doesn't have a lot of continuity to it. And particularly when you're trying to search for that information on your own on the internet, this isn't a time where we lack information. We have so much information that we don't know what to believe or what to understand. And the packaging of the 5 keys framework is what's so interesting to me. And the other thing that I think, and we're seeing this evolve more and more, particularly post-COVID, is just the ability of a digital platform to really cast as broad of a net as we possibly can to get this to people, rather than having them to come to the clinic to actually do one of these programs. And I think between the comprehensive nature and the accessibility, that seems to be the main, if there's 5 keys, the main pillar seems to be, comprehensiveness and accessibility, and that's very exciting.
Yes, and to be really honest with you, we hope that it's a tool that physicians and healthcare providers can say, this is a product that's grown out of medicine, and maybe even if it's in the commercial world, that we recommend to enhance our relationship, not to divide us. We're not in the masterclass, for instance, and any iteration as this goes forward, we would never try to say that I am your doctor. I try to make it clear I am a doctor, of course. But I'm talking to you as an educator, as a supporter of this journey and how we're translating it for you to accentuate the relationship with your physician. In fact, I think that what would be great, and we've done it in the current version of the online masterclass, is educate people about their lab work, because they're not all the docs. And you can skip that lesson too, like the patient I told you about who was just interested in, hey, doc, is it good or bad? Great, it's good. Can we talk about something else? But if they do want to, that they have some really good knowledge about things that frankly aren't often covered, or may just be your sugar's fine or your sugar's high, but educate on A1C, fasting insulin, lipids, how to check a blood pressure correctly. If someone wants to go there, because that can enhance the relationship with their provider rather than separate it. I don't want it to ever be thought of that we're saying that nothing in the walls of medicine is worthwhile. We just know the limit there. Let's give you something that works where reality meets science to take into that world, and frankly, hopefully, even if it matters to you, if it's an accountability factor that is helpful, make your doctor happy. Although it really should be about making you happy.
There's that, and everything you said there. There's that collaboration and synergy piece again. That just seems to be a common thread that's been woven through the conversation. Well, I want to be mindful of time here, and I'm going to give you a couple of semi-rapid fire questions because they're really broad questions, and I'm gonna pressure test you to see if you can be succinct on this. Right. I started this podcast with the idea of frustration, that I'm frustrated by we know so much, yet we're still not helping as many people as we can, and that's what I define as the wellness paradox. This gap that exists. I think you have some insight as to why the gap exists and what we can do to address it. And so now here's the difficult question number one. Why do you think there is a gap? And succinctly, how can we address it?
Mm-hmm. I think, honestly, if it comes down to one simple explanation, is we have set up a culture and an environment that is causing everyone to swim upstream. We touched on this before. It's not like there aren't opportunities to be somewhat more physically active and so forth, but really they are a drop in the bucket compared to the opportunities to not move. And frankly, some of that got really bad during the pandemic and the stay-at-home orders, and the evidence on that is rather shocking. The other is obviously the food environment. When you look at Okinawans, for instance, of the younger generation, let's say less than 50, versus those, and if people don't know, Okinawa is one of the so-called longevity blue zones, right? Where people live longer and healthier. As long as you're in that category where the culture is so ingrained into you that the golden arches aren't attracting you like it is those all under 50. In Okinawa, those under 50 who've been really influenced by that culture and that environment from the get-go are some of the least healthy Japanese, and those over 70 healthy. But if you bring them to the United States, it's not genetics. They have the same health and outcomes as an American. It really is so influenced. Not impossible to get past it. With skill powers, you can, but our environment is set up so that it is hard to be as active as it would ideally be, and it's really more challenging to get to healthy food as it should be. Aggravated now by the pandemic, and we really are stuck in that area. What I think the only way out of it, honestly, is those people that are motivated, we keep building and we give them something that works so that there's a critical mass that starts to build and starts to lead to demands. And I have nothing to do. I'm going to give you an example because I think it's important. I have nothing to do. I have no financial relationship with Panera whatsoever. But they are actually an outlet that has found that, selling to healthy customers is making us money. They started with this secret healthy menu in a tweet years back, and many of us started to complain, stop making it a secret hidden menu. Put it on the menu. If people are not, they're not dumb. If they know what they're eating, it's up to them. Don't make it so hard, and they found it's working. You can now tweak your orders, and there's other places that do it too. I've worked with restaurant chains on Diamo and the area so that they all learn how they can tweak orders to individualize. And over time, maybe these kind of things will actually change the environment. We're building, I think as cities are being built, they're more conscious of walking and biking lanes. But it's, like I got to tell you, it's probably going to be a generation, maybe two. And I don't know how much what's happened over the pandemic may set us back. But that's really it. The environment is so hard to swim up against stream. But when we see the disease that's coming from it, my father has advanced dementia from his type 2 diabetes. It's world-class surgeon, I'm seeing just crumble at 80, and he looks like he's 100. And we're starting to see the ramifications of this that's going to force these things to juxtaposition, that hopefully people will, if we continue to emphasize. It's a simple message. It's not maybe easy, but it's simple. The concepts you need to learn are simple, and then hopefully over time, the demand will increase and we'll start to see the environment change to support it. We may not become Okinawa or Nicoya, Costa Rica, or Sardinia, Italy, but I think we can do that. By the way, we have at least some evidence of that in our own blue zone, the Loma Linda, the Seventh-day Adventists of California, but in that area of Loma Linda, where their choices actually influence that environment, but driven by faith in their Adventist health. But they have an average lifespan that's almost a decade longer than the average American, and they're multiple ethnicities. There's Caucasians, there's African Americans, there's ASEANs, there's Latinos. So it's not a genetic issue. Genetics may load the gun, but lifestyle pulls the trigger, if that makes sense.
Yeah, absolutely. Yeah. And it's very interesting to hear you talk about that. And it seems like the upstream, the top-down approach is going to take a while to manifest itself, generation or two. But this bottom-up approach, the people that are on the front lines, you, I, probably a lot of listeners to these podcasts, if you can get that critical mass, that groundswell of people, and the culture starts to make these little shifts, that's how major movements begin. And then hopefully some of the things that you're saying here inspire the professionals that listen to this to actually be on the front lines even more fervently and more aggressively than they are right now to create that groundswell. That's great.
And to be honest with you, I think there's one issue, and I don't want to spend too much time on it, but for the younger immortal generation that doesn't see disease, for decades down the line, eating this way is really consistent with Eat Lancet, which was a basically consortium of experts led by Walter Willett of Harvard on how can we sustain planetary health. And it was really a flexitarian approach. I mean, if I were to summarize, they were saying double or triple your plants and try to cut your animal-based nutrition in half. And so for the younger audience who might be listening, this has ramifications not just for your future potential health, but the future health of this planet. And it doesn't require extremism. And though I will say this, I want to say just something for my wonderful vegan brethren. This is just my personal opinion, I want more healthy vegans out there. The reason is I know there's just too many people that aren't going to make any change. And if we're going to average at flexitarian in terms of total population, if you want to go that route, I'm going to cheer you on. When I was associate medical director at the Therapeutic and Longevity Center, which is kind of a flexitarian approach, you could absolutely come there and be a total plant pure, or you could be plant predominant. I think anywhere in the plant-rich spectrum, let's all unite. Let's stop this, circular firing squad. We have all the fundamentals that are the same from my presentation, Diet Wars, a tour of duty from vegan to paleo. And I would argue it's plant-predominant paleo, like actually 10,000 years ago with 80 grams of fiber a day and so forth. But that's the real definition for me. Not so much the pop culture version, but all of those, Mediterranean, DASH, flexitarian, which has probably a spectrum that I feel most comfortable with, but a minimally processed vegan approach. If you'll put them on a scale of those 5 principles of beverage calories, calorie density, fiber, protein, combo, sodium, they are all way more similar to each other than that calorie rich and processed sad standard American diet, which is way out here. And so pick whatever you like, pick from a menu and have your 5% fun zone. Don't let people tell you what you can and can't have. But And if you want a definition, by the way, of what that 5% fun zone is, because it's not literal, it's just something that came off the tip of my tongue. And it really is just asking people, what are your non-negotiables? And by all means, enjoy them. Have just as much as you need to not want to kill me until we next talk. That's the definition of moderation, because everyone's on a journey.
Yeah, that's great. It's just, I feel like we could probably talk for another hour and a half on offshoots of all the things that you've said. But the last thing I want to get from you briefly, because I'm a big fan of the concept of appreciative inquiry. and looking at things not from a deficit-based perspective, but from a perspective of possibilities. So with that said, what excites you? You get a chance to interact with the whole ecosystem of medicine and health behavior change and therapeutic lifestyle intervention. What excites you right now about where we're at? We're in a bad place as a society. The pandemic has hurt our confidence. It's hurt our economy. But there are exciting things out there. What excites you for the future?
Well, I would say one thing that may not be specifically what you're looking for, but I am really excited by how many physicians are gaining interest in a group that I belong to, which is the American College of Lifestyle Medicine. And it's amazing how much we are, as a member of the American College of Lifestyle Medicine, are growing, that the interest is there. Now, they may not come into their first conference knowing everything, but that's the whole point. They're there to learn. That excites me, And to be honest with you, things where you start to see hope, like corporate food that is inching towards, and maybe there's one that's standing out more than the others, but Panera is a lead. But those type of things really do show me that there really is hope. And anywhere that you can get that progress, I think we should consider it, as you said, affirm it. I call it progress is perfection. Mm-hmm. Progress, not perfection, to me sounds like something, you should be able to at some point expect to achieve some version of perfection, which I would say is perfectionism, and confusing those two is a real issue. A gold medalist who falls off the balance beam 1,000 times before the gold medal, every one of those falls was perfect for that moment for them to get to the final. So I'm hoping that we can have a culture that will really start to recognize lifestyle as medicine. I think the growth in the American College of Lifestyle Medicine, some signs even in corporate food, we may have a confluence. And I hope to send that message out of progress, not perfection. And by the way, if anyone wants to, have you ever seen the movie Black Swan?
Bits and pieces.
Okay. Natalie Portman, right?
Yes.
The last word in that movie is perfect. And if I'm remembering correctly, she had a lot of psychological burden. There was some, anorexia going on, obsessive compulsive disorder. And for her to be happy with her final routine as a ballerina, she did a scene where she's falling, and at the end, and she falls into the pillows, and the character is bleeding and dying, and for her to have actually self-actualized a true feeling of perfection in that toxic kind of perfection thought, she actually killed her. She actually stabbed herself in order to recapitulate the character in the real world. And so she's there everyone's screaming how great it was. Oh yeah, that's fantastic. You're perfect. And for her, and the last word was perfect, we see the blood everywhere. You know what? Forget that version of perfect. Progress is perfection. Every little bit and every little step you make, you can build on. And sometimes you may take 3 steps forward and 1 step back. Still, be that lifestyle warrior, if you will. And it's okay. We're here with you. And if I can do anything in any way, shape, or form beyond this, whether it's do another podcast or have people reach out to me, I'm happy to help.
That's great. That's progress is perfection. Well, we could keep going on for a while. I know I could, but I want to be respectful of our listeners' time, of your time. Tell us where people can find you. I'll link up all this stuff in the show notes on the website so everyone's able to get information. But just real quick, if people want to find out more about Dr. Tom Rifai, Reality Meets Science, the 5 keys, where should they go?
Yeah, well, there's 2 sites, and right now they're one, but they soon will be separated. But either realitymeetscience.com or Dr. Tom Rifai, DrTomRifai.com. If they want to go straight to looking into the masterclass, it's actually pretty much the same. It's DPM for Diabetes Prevention Masterclass .drtomrifai.com. And you can see all the information. You can scroll down to the bottom and even see the full curriculum. It's got a drop-down menu for all 7 modules. It's a 3-month experience, and you get to be part of my private community long-term, and you get access not just for the 3 months, but we give you a full year access to the curriculum so you can come back and rewatch it.
Love it. And I will link up to all of that in the show notes so people have a chance to check it out a little more. Dr. Tom, thank you so much for joining us. This was an amazing conversation. I really enjoyed it.
Michael, it was an absolute pleasure. And let it be known, absolutely, Wolverines and Spartans get along.
I love it. Thank you so much.
My pleasure.
Well, I truly hope you enjoyed that conversation with Dr. Tom Rifai. If you found the information valuable and insightful, please share it with your colleagues and friends. The whole goal of this podcast is to spread the word about the amazing things that are happening in the health sciences. And it's only through you spreading that word that we can be successful. Any information that was referenced during the podcast that you might be interested in finding out more about can be found on the show notes page by going to wellnessparadoxpod.com/episode 1. Please don't forget to subscribe to our podcast on your favorite podcast platform and be on the lookout for next week's episode when it drops. Until we chat again, please be well.